Well, hello, it's Bruce Williams again, and today I want to present part 3 of my series on the selected gross pathology of the cat, in which we're going to cover the gastrointestinal system. Before we get started, as I always do, I want to thank my friends and colleagues who over the years have provided me such great images, either in online collections or directly, which allow me to put these lectures together, and I hope that you are all proud of the finished product, because I couldn't do it without you. Let's start in the oral cavity of a cat with a probably commonly undiagnosed lesion in many cats. And what I want you to do is look at these grooves at the base, actually under the gingiva. There's been a gingivectomy here. And we're looking at the tooth that's underneath the gingival sulcus. And these grooves are known as odontoclastic resorptive lesions. They usually start in the subgingival area, and they're often covered by either calculus or sort of hyperplastic erythematous gingival tissue. In this condition, odontoclasts resorb the cementum. Remember that underneath the sulcus, the tooth is not covered with enamel, and then they proceed to erode down into the pulp cavity, even resorbing the root. Resorbed cementin and dentin in these cases is generally replaced with a bone-like tissue. These lesions are often covered with a line of granulation tissue in the gum line, and you'll notice that the animal is having trouble chewing its food, or may actually even be swallowing it whole. So if you notice a cat throwing up unchewed food, you may want to take a very close look at its teeth. Now, the resorptive process can go up the dentinal tubules to the tooth crown, and the crown will break off and the gum will often heal over the root, but you got to go back in there and pull out what's left of the root. Sometimes it goes the other way and resorbs the root, but tartar helps, and some ankylosis and bone formation will help keep the crown of the tooth in place, and you don't know that the root's gone. I felt really bad with this cat because the lesions were fairly advanced before I noticed it was having trouble eating its food. Let's move on to another common lesion of the oral cavity of cats. This is known as an indolent ulcer. It has been badly named a rodent ulcer. It has absolutely nothing to do with rodents, and it is one of a member of the eosinophilic granuloma complex, the other two being the eosinophilic granuloma itself and the linear plaque. This one typically occurs on the lips or with the gingiva or within the oral cavity of cats. And if you catch it early, you may find eosinophilic inflammation. But at this point in time, late in the development of the lesion, usually biopsies result in large numbers of lymphocytes and plasma cells and very few eosinophils. They are generally ulcerative lesions, but occasionally you may have somewhat proliferative lesions within the mouth. And this was eosinophilic granuloma as well. Now, the area underneath the tongue is a difficult spot for a number of animals because it is constantly wet, the tissue is constantly bathed in saliva, the tooth is constant, or the tongue is constantly moving back and forth. And it's very difficult to re-epithelialize lesions. When I look at something like this, I often think that it might just be sort of a ball of granulation tissue. In a cat, you always have to take multiple biopsies, look for the presence of eosinophilic inflammation, as well as the presence of squamous cell carcinoma. But I've looked at many of these, and the vast majority are just areas of granulation tissue because it doesn't have the chance to re-epithelialize before it gets ulcerated again. Here's a classic picture of a animal with chronic stomatitis. And a number of viruses can be recovered from cats with chronic stomatitis. Many of them will have FIV or FELV, but one of the ones that causes the characteristic formation of these blisters, often at the edge of the tongue, is feline calicivirus. It's a cytolytic virus that affects a couple cells, and because it's cytolytic, the necrosis of those cells results in infection of adjacent cells, with these lesions enlarging centrifugally. Tongue's not the only place that you can see these lesions. You can also see vesicles and ulcers. You know, these don't last all that long, so it's very difficult to see. This is a great picture because you have some nice vesicles. Usually what you get are these areas of ulceration, but you can also see them on either side of the midline of the hard palate as well. The virus is probably hanging out in the palatine tonsils. These vesicles tend to heal up within 10 to 12 days. But these animals also, or often, have a number of other conditions. Calicivirus is a very common part of chronic respiratory diseases in cats, with rhinitis, and in most cases there's a mild lower respiratory disease as well, including a necrotizing bronchitis and pneumonia. And if you get a good biopsy early in stage, you might see a classic interstitial pneumonia. Later on in the lecture, especially when we get into skin, we're going to talk about a new form of calicivirus, and I use that term sort of loosely because it's been around for about 15 years. It was discovered by Dr. Patty Pesavento in shelters in California, in which the disease and the severity of the calicivirus infection is markedly ramped up, with a 55 to 60% mortality, much more severe lesions, a necrotizing dermatitis, and cellulitis, and pancreatitis, which really adds to the mortality of this particular disease. In these shelters, up to 25, and in some cases people say 100% of asymptomatic cats will be shedding this particular, harboring and shedding this disease at any given time. And even 10-15% of pet cats, with no exposure to other cats in a long time, will continue to shed this particular virus from the oral cavity. It can be recovered from as many as half of all upper respiratory infections, where it often partners with other viruses like feline herpes viruses or bacteria like chlamydia. Also, in rare cases, calicivirus may cause, especially in kittens, an acute arthritis and sort of a shifting leg lameness. Hey, whenever I see ulcers in the cat's mouth, I think the first thing I'm going to look at is examine the age and the ClinPath data on these animals. Make sure I'm not dealing with uremia, because chronic renal disease, as we'll see later on, is a very, very common problem in cats. So this is feline calicivirus, and if you have one virus, you often will have several others. But since we're talking about it, here you go. These are the bilaterally symmetric ulcers underneath the tongue, which is so characteristic of uremia due to chronic renal failure in the cat. And the reasons they pop up on the underneath side of the tongue is that in animals with very high circulating levels of urea and nitrogen, in certain parts of the body, it will exude through the mucosa, and if those parts of the body contain urea-splitting bacteria, like the mouth, it's going to raise the pH. It's going to become very alkaline. And so what happens is it breaks down the urea that exudes through the mucosa, and the saliva, which collects underneath the tongue, becomes sort of an ammonia bath, for the use of a poor analogy. And so the tongue is sitting in there, and it's sitting in this sort of caustic substance. Also note that the ulcers are bilaterally symmetrical. Whenever I see any bilaterally symmetric lesion, I always think about the possibility of toxic disease or metabolic disease, and I'll start there. Here's a fantastic picture that I got so many years ago from Dr. Lois Roth. And we see large areas of granulation tissue at the back of the mouth on either side near the exits of some minor salivary glands, and this area is known as the fauces. And we're looking at granulation tissue, and if you were to biopsy this, you would probably see large numbers of lymphocytes and plasma cells, and this particular disease has undergone many name changes over the years. I learned as plasmacytic stomatitis, which was great because that's essentially what the biopsy would be, a very descriptive name for a pathologist. But now that we've seen the rise in dentistry, they couldn't let that stand. So it is known currently as feline ulceroproliferative fasciitis and stomatitis. The Merck manual just says feline stomatitis, and that's fine. And it appears that this is a reaction to periodontitis and changes in the gingival flora. And the only really effective thing that you can do for these animals is to remove all of their teeth when it helps it clear up. And I have a cat who had terrible necrotizing stomatitis, and I took all of her teeth out about 4 years ago, and she had just bounced back. She's a totally different cat now that her mouth doesn't hurt her. And you know, before that she was probably she still swallows most of her food whole, and but before that she wasn't chewing it either, so she's doing just great. So taking a cat's teeth is not the most horrible thing in the world that you can do with a cat. Now, you may see some other corroborative evidence and some other signs in these cats with these tremendous plasmacytic areas of inflammation. Look for polyclonal gammopathy, because these aren't a single clone of plasma cells like you might see in myeloma, and they're all plasma cells are going to produce some antibodies, so that's going to run the gamma globulin section of your pheresis way up. Some of these animals have plasma cell pododermatitis, as we see as well. And then anytime you have this chronic antigenic stimulation with plasma cells, you may see a concomitant glomerulonephritis develop over time. But these will clear up. You won't have those problems if you can get this cat's teeth out. Over the years, back in the day, you know, like any disease of the oral cavity, this was blamed on feline leukemia virus, feline calicivirus, FIV, and obviously it's all turned out to be just concomitant infection in some of these animals. So feline ulcerative proliferative fasciitis and stomatitis. I'm sorry, I'm always going to call it plasmacytic stomatitis. Oh, stomach of the cats, they don't get all too much. They can get some worms in there, but this is a nice picture of a condition that is seen in cheetahs. Can also be seen in domestic cats, and this is multifocal to coalescing areas of gastric hypertrophy due to Helicobacter. In this case, being a domestic cat, Helicobacter felis infection. And these areas of proliferation of mucosa are most likely to be areas of lymphoid follicular hyperplasia. Cats get a number of Helicobacter species. They can harbor Helicobacter pylori spontaneously, as well as humans, of course, and some selected macaque species. Helicobacter felis is another one. Helicobacter hyalomanii is common in domestic cats as well. Most of these are experimental infections, or at least the ones we have pictures of, because the disease is generally subclinical or very mild in cats. It has been shown in a number of shelter studies that up to 100% of the animals can harbor the bacterium. Okay, moving further down, the small intestine, and Williams' rule of red guts #1 is that if it's a dog or a cat, we're going to think of parvovirus first. Talking about calves or pigs or foals, then we're going to switch over to Clostridium perfringens. But in the dog and cat, we're always going to think about parvoviral infection. The morphologic diagnosis would be a segmental necrohemorrhagic enteritis, and this would be the province of feline panleukopenia virus, which is also a parvovirus. So feline parvovirus, panleukopenia virus would be my first choice here. Feline retrovirus can also do that. The thing about feline panleukopenia virus is it is very selective for the small intestine, whereas retrovirus can go up into the colon. It's not as picky. Parvoviruses always look for cells in a particular stage of the cell cycle because they are so-called replication deficient. Histologically, nothing looks like feline panleukopenia. In acute cases, you will have crypt destruction and resultant villar blunting and fusion. Notice I didn't use the term villar atrophy. I don't particularly like that term because you have food, there is stimulus, and generally atrophy is what happens to a particular organ if there's no stimulus. They do blunt, they do shorten. If they are denuded, they will shrink down, and then they'll fuse because the body is going to reepithelialize as quickly as possible. Often 4 or 5 villi will fall together and the body reepithelializes over all of that, resulting in a 80% loss of absorptive surface area. In adult animals, there are only a couple spots that you will see active necrosis due to feline panleukopenia in. The intestine we have mentioned. The bone marrow will always have some spots, and of course the lymph node. Up to 2 weeks after infection, you can still infect the external germinal layer of the cerebellum. So you can end up with cerebellar hypoplasia. We tend to think of it as an in utero finding, but remember that in puppies and kittens, especially in this case in kittens, that cerebellum still develops up to at least 2 weeks out. It's not quite finished when the animal is born. That's why little baby kittens sort of stumble and wobble all over the place. Go ahead in these animals and look for the thymus. It's usually markedly involuted. But if you're looking for lymphocytolysis and lymphoid necrosis, best microscopic lesions are going to be in the ileal Peyer's patches. Chronic lesions, animals, and as I said before, nothing else looks like this. It is a radiomimetic lesion, which means it mimics the effect of radiation with marked loss of crypt epithelium. The crypts will be thinned out. You'll have extensive edema, and ultimately, if the animal survives, there's often a band of fibrosis, a very prominent, sort of in the middle layer of the mucosa, that will signify that this animal may have been exposed to panleukopenia virus in the cats. And if you open these animals up, parvoviruses in dogs and cats have a particular sewer-like smell to their GI tract. Dogs tend to handle parvo a little bit better, but usually because there's so much ulceration, they end up dying of endotoxemia. Cats will die of the effects of the virus itself. And both of those diseases we often see in younger animals following the waning of maternal antibody if they are not vaccinated. A classic lesion, a fixed specimen, but back in veterinary school we were all taught that if you see accordion pleating of the GI tract, the intestine of a cat on a radiograph, you're probably dealing with a linear foreign body, and that's exactly what we have here. And you can see the pleating, and you can see the path that this foreign body took, and I don't know whether this was a mop string or a piece of dental floss or a large ascarid or some hair, but you can see that there's areas of ulceration and hemorrhage throughout here. I don't know if this particular part caused a perforation. One thing I can tell you is somewhere, somehow, one end, usually the proximal end of that foreign body, got anchored. You see this a lot with a piece of cloth that's wrapped around the tooth or the base of the tongue. And it has to be anchored, and then that segment of intestine continues to squeeze and try and move it along by peristalsis, but it can't move along. And so as it squeezes and squeezes and squeezes, it just wears a hole in the mucosal lining of the intestine. Sure, it could have been one of these worms. They'll do that too, and sometimes they will get anchored in the pylorus, and seen a number of animals that have used large ascarids as a foreign body. Sure, here's some ascarids in here, roundworms. They don't cause much of a problem. Toxascaris leonina is a good one, and they sort of subsist on whatever's coming through. Of course, a large mass of roundworms in a small animal can cause problems, including obstruction. They tend to prefer the higher regions of the GI tract, including the duodenum. And we've talked before, a large mass can result in obstruction. They can result in a perforation if the anterior end is anchored. Toxicaricattae is another one. And then Physoloptera, you can see in the stomach. And then a number of cystoparasites you can find, including Dipylidium caninum in the feline intestine, because that animal has eaten a flea. And Dipylidium is passed from the flea to the cat only after the ingestion of the flea, not the ingestion of the little wiggly segments that you may occasionally see in the feces. When we talk about hookworms, generally they are more of a problem in dogs, but the same situation is this in cats. Hookworms are bloodsuckers, and they move from site to site. They only feed for a small amount of time at any site, and then they move on to another one, leaving an open bleeding site. So even a small number of hookworms can cause significant issues in young cats. A couple of species to remember would be Ancylostoma tubiforme, Ancylostoma brasiliense, which affects both cats, dogs, and humans, and Uncenaria stenocephala, all which can cause a diffuse blood loss anemia in infected animals. Here's a very lumpy, bumpy intestine, and this is what is often seen in association with infections with dimorphic fungi. This is a granulomas enteritis, maybe due to histoplasma or blastomycosis, one of a number of different organs that can be affected by these dimorphic fungi. And I think it's a little more common to see that than to see something like Cryptosporidia. I've seen cases of zygomycosis, another fungus which will cause intestinal lesions in cats. I suppose that you could see Mycobacterium avium that could cause granulomas enteritis, but I don't know if I have particularly seen these, but these are usually segmental infections, and you can imagine what this would do to the mucosal lining. They often expand, and you will have adhesions to surrounding mesentery, and the thickening of the mucosa and the submucosa. They don't stay put in the mucosa, but the thickening of the mucosa, submucosa, even the muscular walls can be absolutely profound in these particular animals. I would not totally rule out the possibility, although it's usually, as we'll see in a minute, a lot smoother. I wouldn't totally rule out the possibility of lymphoma here, but I think this lumpy, bumpy, very thick gut would be farther down the list. Before we jump into those tumors, let's look at one more condition of the GI tract, or the enteron of the cat, and that is a very enlarged colon. If you want to call it megacolon, that's fine. There's a number of causes of megacolon in cats. In white cats, and usually they're idiopathic. You usually don't figure out exactly what it is. If the cat's white, it may be secondary to a defective migration of neuroblasts from the neural crest to the colorectal myenteric plexus. It can also be due to spina bifida in cats, in which you have an opening of the overlying vertebral body. Often you'll have a stoma going all the way through the skin, and what we see in these cats is at this area just past the the lumbosacral plexus, you'll see this tangle of nerves, and the innervation to the bladder and to the colon is usually defective. Don't forget some simple causes in very young animals. Atresia ani, you can see in any species. It's not very common in cats. Or a broken pelvis. You'd be surprised, probably wouldn't be surprised, how long cats would hold their urine or their feces because they've been hit by a car, and the pain that even simple voiding would cause. So there's 4, 5 good causes of a very obstipated cat, and accumulation of feces. And then sometimes cats get just constipated for no reason and need to receive some relief from their veterinarians. Okay, moving on to the just a couple of common tumors of the GI tract. Today, now that we vaccinate for feline leukemia, probably, at least in older animals, the most common, and in most surgical biopsy practices, the most common tumor that you will see is going to be squamous cell carcinoma of the oral cavity. In old cats, it's about 60% of neoplasms, and everything's been incriminated, but it's probably just an old cat thing. A number of those viral infections have been incriminated. Cigarette smoke, secondhand smoke, has been incriminated. And this is a very small study, but my mother-in-law smoked like a chimney, and she had 2 cats. They both died of oral squamous cell carcinoma. For all I know, she was, letting them puff on the cigarettes too. It's a classic lesion. If you see it around the teeth, you will see loss of the teeth, extensive ulceration. And it's not something that kills animals outright. It doesn't metastasize till late in the course of disease, the vast majority of cases, but ultimately something like this is going to cause a pathologic fracture. Underneath the tongue or in the soft tissue of the between the jaw bones is also another common place, and this animal is going to have trouble prehending food. It's going to be drooling. You'll notice that the animal's breath is terrible, and eventually these animals are put down for humane reasons. Squamous cell carcinoma, a big killer of old cats. Okay, remember I showed you the lumpy, bumpy gut, said it wouldn't be top of the pops for me for lymphoma. This is lymphoma. Lymphoma of the gut in just about any species doesn't have a long survival time because usually when you cut through the wall, it's all lymphocytes, and we've eroded the mucosa, so anything coming by basically has direct access to the bloodstream. So GI lymphoma is not one that works all that well in terms of a long prognosis. Oftentimes, if you have adenocarcinomas, you can cut them out. Not with lymphomas, because usually they extend well beyond the borders of the obviously affected tissue. We've talked about, we've mentioned the types of lymphoma that you see. Majority are T-cell epitheliotropic lymphomas. You also have transmural B-cell tumors, which possibly arise from previous inflammatory disease. And then the one that is, at least for a pathologist, is always fun to get, the large granular lymphomas, where these purple granules show up very nicely on cytology. I wish they were a little more impressive on histology, but not. And if you have, they're interesting if you have a immunotest for perforin. They're often a perforin immunopositive, and it helps to identify because those large granular lymphomas are not monomorphic. They're also usually part of a mixed cell infiltrate, so it helps pinpoint those particular cells. Intestinal adenocarcinomas, gastric adenocarcinomas, or colonic adenocarcinomas, not uncommon in cats, and look at the difference between that and our lymphoma here. This one is very discrete. You can see it here, proximal to the constriction. The GI tract is dilated and full of food, and because this is an epithelial neoplasm which produces fibrous connective tissue in a profound scarce response, it constricts down and occludes the gut, whereas that lymphoma does not. These have been known as napkin ring carcinomas. if you can catch them before they've metastasized, and before you have the damage that's done to the proximal tissue, then they carry a better prognosis surgically than those lymphomas. Something like this, where it's already all stretched out, I don't know if you're going to be able to get beyond that, even if you have a successful surgery without metastasis. The intestinal adenocarcinoma is a little more common in cats than dogs. They usually pop up at the ileum, then the jejunum, and Siamese cats have some sort of breed predisposition for this particular neoplasm. And here's one that's been cut, and you can see probably, and it's, honestly, it's sort of tough to tell. I'm assuming that this is going to be proximal. This is going to be distal. The only thing about this is this doesn't, it looks sort of flat, like it's been stretched, but I'm assuming proximal. Let's go distal here. This one looks a little baggy, and you can see the thickening of the wall, and a lot of that is just scarred tissue. Sometimes they can be so paucicellular, it's tough to pick out the neoplastic cells within the scar tissue, and you have to throw a cytokeratin on it just to identify the scant sprinkling of neoplastic cells in some areas. Now, the last condition is, there's a great picture from Ivan Galindo. The condition is not truly neoplastic, but I've always said that if you give a cat a little inflammatory stimulus, it's going to try and make a malignant neoplasm out of that. That's just the nature of the cat. You poke them in the eye, and they're going to make a intraocular sarcoma. So they just go overboard. You give them a vaccine, all of a sudden you have a life-threatening fibersarcoma. They go overboard with the inflammatory response. And this is a condition that was written up by Dr. Lyndon Craig of the University of Tennessee quite a number of years ago, and did a wonderful job with this. And here we have the stomach, here we have loops of gut, and then we have this thick casing of fibrous connective tissue. It's not a fibersarcoma, it's not a neoplasm, but it sure is trying to be. And the condition goes by the name feline eosinophilic sclerosing peritonitis. Just to be even more confounding, and cats do whatever they want, they throw lots of eosinophils in here. And this particular condition arises whenever you have some type of leakage of bacteria or gut content from the intestine. And that stimulus within the peritoneum causes tremendous eosinophilic and fibrosing response. And the big problem in these particular animals is incarceration, obstruction of loops of bowel of the gut. It's something that you look at initially. It was actually misdiagnosed early on as a sclerosing form of mast cell tumor, but whenever you have enough eosinophils, some mast cell tumors are bound to be in there as well. But it is a proliferative and inflammatory response that mimics a neoplasm in cats. Well, that brings us to the end. You know, the GI system of the cat's a lot like that of the dog, so there are probably some conditions that I could have mentioned here that we've already covered in more depth in the dog. And I also would mention that the Foundation's YouTube channel and the JPC's video library has a full set of lectures on the GI system of all the domestic species, and I think there were 3 lectures on the intestinal tract, just the small intestine, in that lecture series. So I would encourage you to go back if you're interested in the GI tract. I'd go back and look at some of those lectures, and you don't get just the cat, but you get everything from chickens to exotic animals as well. Well, this brings us to the end of this particular lecture. Hope you come back. We're going to finish up the GI system with the hepatobiliary system and the pancreas. And there's some good stuff going on in the cat in that system as well. As always, I wish you good health and a great day.